When a suspicious lesion appears in a woman's breast, a biopsy may be needed to see if there's cancer. This used to mean open surgery. But today, we can obtain tissue samples using a faster, safer, much less invasive technique: image-guided stereotactic breast biopsy. Hologic provides a sophisticated tool for this procedure. We call it Stereoloc 2. Stereoloc 2 is part of a family of biopsy guidance systems from Hologic. It mounts right onto your Selenia digital mammography unit, so the same suite can be used for both screening and intervention. The system uses stereo X-ray images of the breast tissue to precisely pinpoint the lesion in three-dimensional space. This way, the tissue sample can be extracted quickly with no guesswork. The patient can either be reclining or seated, depending on the desired angle of approach. The mammographer positions and compresses the breast just as she would for a mammogram.
Okay, stay nice and still. Hold your breath.
Then she takes 3 X-ray images, one straight-on scout view, and one each from 15 degrees to the left and right. Since the beam is fixed at 90 degrees to the receptor, the images have no parallax distortion.
Okay, stay just like that. Hold your breath for me.
The stereo images go directly to the digital spot mammography workstation, where the doctor now selects the point of interest as seen in both points of view. Once she transmits this information, the system mathematically triangulates the exact position of the lesion as a set of XYZ spatial coordinates. It automatically moves the biopsy device to the correct X and Y position. Then the doctor carefully dials in the Z-axis. She cleans and locally anesthetizes the patient's skin and makes a tiny incision for the biopsy needle. At each stage, a new set of images confirms that the device is absolutely in the right position. Then the doctor deploys the device, and tissue sampling can begin. The Suros ATEC biopsy device, used for tissue collection, is a work of advanced engineering in its own right. Capable of continuous lavage during aspiration, so all tissue can be collected in one pass. You can use it to deliver local pain relief during the procedure. And you can deploy a permanent radio-opaque marker to show where the biopsy was done for future reference. You can send the stereo images to a secure view dedicated diagnostic workstation for an interpretive report, and then store them to PACS or another DICOM archive. Including recovery time, the whole procedure may take about an hour, and instead of a scar, the patient is left with a tiny nick that heals in a few days. The result is a very high-precision sample, captured and delivered faster than was ever possible before, making the most of your team's expertise and maximizing their productive time, even while reducing anxiety and enhancing quality of care for your patients. In every way, Hologic is working for women's health, to help physicians see more clearly and act more swiftly, to help save more lives.